Well, to continue the conversation on health equity and innovation, I'd like to welcome to the stage my colleague Jessica Jenner to lead a conversation on innovations in diagnostic testing and LMICs with HemoCue.
Hello, everyone. I am pleased to be joined by Lena Wahlhed, who is the Director for Alliance Development and Regional Sales Director for Japan at HemoCue AB. Now, HemoCue is also a Devex Summit partner, so special thanks for your support this week. Today in this segment, Lena and I are going to be talking a little bit about diagnostics. Now, imagine most people in this room know how crucial diagnostic testing is in identifying conditions, health conditions early, and enabling timely interventions and treatment. Yet around 80% of people in low and middle income countries have either little or no access at all to even the simplest of diagnostics. So Lena, perhaps you could start off our conversation with talking a little bit about these resource constraints faced in these countries and what innovative solutions can be leveraged to increase accessibility and affordability.
Yes, thank you. And it's an honor to be here. Devex is fantastic. I've learned a lot since being here these 2 days. So innovation, my usual comment to that is that the best innovation is the one that lasts, that is cost efficient, that can be used in the environment where it is to be used by the intended user. So HemoCue started 40 years ago with a company doing hemoglobin testing. Hemoglobin was discovered in the 1840s and won the Nobel Prize in 1962 when they found out how the molecule worked. In between, there was access in laboratory medicine. HemoCue started in 1982 for point-of-care diagnostics, bringing these tests out where the laboratory is not available. And hemoglobin, I think, is one of the most important laboratory tests that there is around the world. It's a symptom, so you need to further understand what is the cause of this, but actually having the test available has an immense impact. We heard yesterday about the Minister of Health from Indonesia talking about bringing healthcare further down to the villages. That can also be supported with having the point-of-care devices still provide the correct answers, the correct results, but actually enabling availability also in these communities.
Thank you. And just going back a little bit to the resource constraints, specifically blood donations seem to be limited in LMICs, leading to challenges in providing necessary transfusions to those in need. Lena, are there public health strategies that can be implemented to reduce the demand of blood donations?
Yes, there is. And I'm actually going to read out loud here because I think it's important to get this right. So there is... WHO published a policy brief in 2021 that speaks about patient blood monitoring. And the first sentence says that while there has been improvements in blood component safety, there has been less focus on transfusion decisions. There is a patient-centered approach that addresses iron deficiency anemia, coagulation disorders, and blood loss as risk factors for adverse medical outcomes. Under patient blood management, anemia and iron deficiency are recognized as serious global health issues in their own rights, affecting billions of people worldwide. Yet it is still, globally, a gap in awareness and implementation of patient blood management as an overall framework to address risk of iron deficiency anemia, blood loss, and coagulation disorders. And it's not intended to reduce the number of blood transfusions, but giving it to the right people when it's needed. And what we talked about also yesterday, about today, there is more elderly people over the age of 60 than there is below 5. Understanding this, also blood donors might be fewer. So I think it's important to allow those blood donors to give blood to those that truly, truly need it. And if we can avoid anemia during the years, in childhood, in adolescence, in pregnancy, in our working life, then we might be better off when life comes towards us, so to say, so that we might not need blood transfusion necessarily. So that I think is a big public health opportunity.
Absolutely, thank you. And I just wanted to go back quickly to, you mentioned earlier, point of care testing. So we know that point of care testing holds huge potential for those in lower middle income countries. Why is that? And perhaps you could share a few approaches that HemoCue are taking to develop and deliver effective point of care diagnostic testing.
So again, HemoCue has a pretty small portfolio, but the analytes or the solutions that we have are those that are part of the essential diagnostics. We are very mindful of not suggesting overuse of diagnostics, but only those that are needed at a point of care to support the physician and the patient in the decision-making and actions. So I think that is bringing it to those that really need it at a point of care has a huge impact. And I mean, if you are in LMICs, you might not have access to laboratory, but you can have access to point of care diagnostics that can at least support initially.
Great. And you mentioned that your portfolio is small, but we know that scaling up access to diagnostic often requires collaboration. Perhaps you could share some examples of ways you've partnered with governments or NGOs or other key stakeholders.
Yes, so the portfolio is small, but impactful. So I think that is important. So yes, so we are a company based in Sweden. We work with distributors globally, understanding, listening to the needs of the countries, the Minister of Health, the NGOs that is out there. Our distributors are our voice in the countries. And I think it's a lot about listening and understanding. We don't give medical advice. That's not our role. But we can listen to what the need is, and then we can suggest how our solutions can support in the support that is needed. So we do have for hemoglobin, as I mentioned, for anemia, we have glucose and glycemic control for HbA1c for diabetes. And in that spectrum, especially for the diabetes part, where there might not be as much funding, there can be other partnerships with other companies that we can provide the monitoring device, whereas they can provide the treatment that is needed. So I think that is also an important partnership, looking at the innovative ways, again, innovation. How can we do this together? Because we cannot walk alone. We need to do this in partnership.
Yeah, it's a great point there. Now, this year's theme of WHA is All for Health, Health for All. So I imagine you're quite excited to hear about the various health equity commitments that might be emerging this week. Is there a specific action or commitment that specifically around essential diagnostic testing that you're hoping to arise this week?
Well, I hope it will continue. I did a walk the talk in New York at last year's UNGA, and I think that we need to do that also as the companies. We need to, what we say, we need to walk the talk. I think I also, again, leaning towards what we listened to yesterday, the Minister of Health from Sierra Leone, talking about the achievements that they have done, not just looking at the numbers, but every single woman is important to have a good, healthy pregnancy. And I would like to see that continuing as well. And I always think, so what can I do? Because I'm also part of this, All for Health, Health for All. So I can see what can I do within my community, and community doesn't need to be a village, it can be other kinds of communities, looking about my colleagues, my friends, their communities, so that we don't just see the numbers, but we see behind every single number, there is a person, and that person deserves health to the best possible way.
Thank you. And in these final moments, perhaps you could just share a final call to action that our audience, both here and online, can take away with them around essential diagnostics.
If there is one test I think that should be on the public health agenda, it is hemoglobin, because that cuts across so many different ages. If we look at health through life, so many diagnoses, again, cuts through diseases. I saw here earlier today, ISN was on the agenda. I used to work with ISN and the National Kidney Foundations. Chronic diseases, anemia is involved there as well. Mental disorders, aging. It's very often that anemia is present in aging, but we shouldn't take that for granted. We should see what can we do, because with anemia comes some other issues. So I think that's my call.
Thank you so much, Lena. And thanks again to your colleagues at HemoCue for this partnership. Thanks everyone for engaging today, and we wish you a great WHA. Thank you.